It's encouraged, although it's not required, but it's encouraged to find acupuncturists that is NCCAOM certified. As a teacher in many conference and acupuncture school, there are a few tips that I'd like to share. Finding a good acupuncturist, first of all, in America, all acupuncturists need to be state licensed, or in most states, the acupuncturist needs to be state licensed, just like any other medical professionals. And like, for instance, in my state of Colorado, we have a Colorado state license for acupuncturists. And also, it's encouraged, although it's not required, but it's encouraged to find acupuncturists that is NCCAOM certified, because it's the national recognized certification for acupuncturists. Acupuncturists that pass an NCCAOM certification means that they have the requirement to graduate on the accredited school from the national board. So it's good to have that as addition. And also, because acupuncturists, a lot of time it will be better to understand not just acupuncture, but the whole spectrum of TCM, which includes Chinese herbs, TCM herbal formula, TCM lifestyle modification, meaning the food therapy, the concept of Qigong, or they practice Qigong, that's even better, and also meditation as well. Because Chinese medicine is not just a medicine, it's not a symptom reduction medicine, so to speak. A lot of time it requires the patient and the practitioners work on connecting the body, mind, and physical and emotional as well. So it's good to look for that. However, I do want to point out that Chinese medicine is not about symptom reduction. If we want just a symptom reduction, a lot of time, like for instance, back pain, neck headache, if we want to focus on the symptom reduction, the pain medicine actually works better because it works faster. However, it doesn't help to from the root cause. So when we focus on the root cause medicine, Chinese medicine doesn't just give you a herbs or needle. The acupuncturist or Chinese medicine practitioner, they will ask you what happened before you come into the clinic, and what's the pattern that has been going on for months, years, or decades. What does the acupuncture see from the tongue, pulse, abdominal diagnosis, and also what is the state of qi like, and is there any pathogenic, we call it pathogenic struggling with the qi, and how was the state of that. So these are the things that Chinese medicine practitioner will always look at. So it's not just, okay, tell your acupuncturist I have a headache and treat it now. Your acupuncturist should ask, how long has the headache been, and what was it like before this? And for instance, the weather, is the weather a trigger? And then the acupuncturist will check the pulse and tongue and see if there's any deficiency, abscess, or stagnation. A lot of time that when a patient comes in for acupuncture or herbs, a lot of time we're talking about plans. So a treatment plan of, okay, what should we expect in, let's say, in different season, different time, different state, different places you go, because that external environment affects our internal environment as well. The Chinese medicine practitioner should also discuss that with you as well. Of course, there are times that if you already establish a good rapport with your acupuncturist, of course, a lot of time we know this patient for a long time. We know usually what kind of pattern we're seeing. So if you suddenly have a, let's say, headache, you might be able to go to get a treatment in and out. But building rapport, building long-term relationship with our patient is actually a very important thing for Chinese medicine practitioner. If you like this video, please subscribe and follow me, and I'll see you soon.